Hello viewers, welcome back to my channel. This is Sarah at All About Women's Health. Thank you for subscribing to my channel, and I would like to encourage more people to subscribe and turn their notification on. Thank you. My aims of producing this video is to bring health information to your doorsteps. It doesn't cost you anything than just to turn your phone, your TV, YouTube, go there and sit down and watch. You do not pay for it. It's free. And please do me a favor, share it to the less privileged women that are not able to be in that environment where this information is easily available, and most importantly for those women that did not have the privilege to go to school to be aware of their body. So please do help me to share this information with them. So today we are going to talk about annual visit. What are the things that should be done when you visit the doctor office, and at what age will a woman visit the doctor for a gynecology visit only? So, and I'm here to give you tips on that. So let's get started. So on this week video, we're going to talk about women's health visit, annual visit to the doctor. So at what age do women actually go to see the doctor? Is from age 13. We're going to start from 13 to 19, and I'm going to tell you about things that you will be discussed with your doctor, or the things that your doctor will discuss with you also. So at age 13 to 18, women will be assessed for obesity. They will be assessed for hypertension. They will be assessed for high cholesterol. They will be assessed for sexual abuse. They will be assessed for drugs. Yeah, they will be assessed for issues at school, bullying, whatever is going on in their life that can disturb their future. This is a time to discuss about it. And also women will be discussed, the doctor will talk to those young women concerning sexual activities. Remember, you do not want your girl at this age to be pregnant, so this is the age to talk about sexual activities with young women at this age. Also, the doctor will talk about substance abuse, if there's any substance abusing going on. We'll talk about depression. Yes, young children do get depressed, so it's very good idea to discuss. So your doctor will discuss this with you. And all vaccination would be discussed at this age also. The woman would be young girls who talked about human papillomavirus and other vaccination that is due at this age. So the next age group is 19 to 39. At this age group, hypertension continue to be an issue that will be discussed. High cholesterol, diabetic continue to be a topic that will be discussed or checked out at this age. Infertility, yes, will be discussed at this age. Sometimes women have no issues, or maybe there's an hormonal imbalance going on and the woman doesn't know. So when you go to the office, tests will be done to see your hormonal level in the body. Pelvic pain will be present, and some women may experience pelvic pain, some will not, but the doctor will just be able to ask if there is such issue going on. Vaginitis, which is one of the things that I presented in my previous video, will be asked, which is due to poor personal hygiene. This will be addressed, and some tips will be given by the doctor. Sexual transmitted diseases. Remember, women at this age who most of them are sexually active, so this need to be done, because if there's any infection and it's not treated on time, remember, I always emphasize on this, it can lead, infection can settle anywhere in the body, but it can also settle in the fallopian tubes and blocks the tubes. That is not the only reason why women have infertility problem, but it's one of the reasons, so it need to be discussed. Pap smear pap smear is done, is a test to see if a woman have cancer or any possibility of having cervical cancer. This test is done at this age. So women from 40 to 64, this is another age group that need to be addressed. At age 40, most women, not all, most, hear me well, most women will start to experience menopause symptoms. So this is the time to talk to your doctor about any symptoms that you're feeling age 40. Mammogram is recommended at this age. For those women that does not know what mammogram is a test, is a picture. It could be of a picture, it could be like a pressing. They put your breast in the machine and they press it and take a picture of it. And also it could be done like scanning, using like a little tube or something and rub it around your breast and they take a picture of it. So mammogram is a test that is done to check if a woman have breast cancer. Breast cancer is not a new thing now. A lot of people are aware of it. Early intervention leads to early detection leads to early intervention. So please encourage women from age 40 to start doing mammogram tests. But mammogram is actually done at age 50, and colorectal cancer is done at age 50 also. Colorectal cancer is actually a test that is done, let me use a layman word, your intestine, that is colon, your intestine. A test will be done to be able to identify if a woman have colorectal cancer. Diabetic also continue to be screened at this age. Thyroid and hypertension continue to be screened at this age. Age 65 and older. Every other thing that I mentioned on this video, sexual transmitted diseases, hypertension, diabetic, high cholesterol, will be screened. Depression will be screened. Sexual abuse will be screened also. But what is more important at this age group is screening for unintentional fall, screening for ovarian cancer, screening for Alzheimer's diseases, screening for osteoporosis. Unintentional injuries could receive a health education or just a good advice on what to do and how to arrange our house. Most of the fall occur due to overcrowding around their house. So women at this age need to start to decluster their house, put things in order, avoid overcrowding of things so that they don't fall, because their reaction time has reduced. So it is very important to visit doctors. Some people might say, oh, a simple thing as arranging your house can lead to fall. Why will I receive an education for that? Trust me, it is very important. We don't want you to fall. We don't want you to have any injury. So it's very important to discuss with the doctor concerning most of these things. So age 65 and above, you continue to screen for bone density. Bone density, especially for women that have history of osteoporosis, such as fracture or low body weight. They need to be screened for all these things. Thank you for watching. I hope this information is beneficiary. Share it. Stay tuned for other topics that I will bring, and please do remember to turn your notification on. And one good advice that I have for you is that, especially for people in developing countries, it is not easy. I know there's no health insurance. Most of you don't have health insurance that you can walk into the doctor office in and out and do these things. So here is my tips for performing your annual visit